So CO2 lift, that's what it looked like. And all of you will experience this today. We're going to be putting it on some hands, is the first carboxy gel on the market. And it can be used in the office. It can be used with various different providers, surgical, aesthetic providers, estheticians can use it, but it really is a powerful anti-aging solution. It can be applied to all parts of the body. That's it there. And again, what is carboxy therapy? It's a therapeutic use of CO2 gas to regenerate the tissue. Again, it has a long history. It actually started back in the 1100s with the samurai warriors, and then most people commonly know about it with injections. And then again, we have the first gel. But as you can see from the picture, that's pretty much how it works. It's not a device. It's a gel that once it's applied to the skin, it penetrates to the microcirculatory level and it expands the capillaries, bringing along with it not only blood supply, but all the rich nutrition that's in the blood. The science behind it, I'm sure all of you did this in medical school, the Bohr effect. When you change the level of concentration of CO2 in the blood, there's the ability for the hemoglobin to transport the oxygen diminishes and it unloads in that area. And so that's why you're getting that high supply of oxygen. That's what it looks like in a video capillaroscopy machine. One of our studies, we looked at what it's doing under the skin, and you can see microcirculation improved 28%. These are some of the effects of when you put the CO2 on the skin. It's improving vasodilation, flow motion, neoangiogenesis. That's what is happening with the skin, underneath the skin. And as I mentioned, we've invested in several clinical studies. I think what's most impressive to me is the hydration level. I always like to say you don't get old, you dry up. And there's nothing on the market that improves hydration like this, 117% after one application. And then, of course, the skin quality. You're looking at what's in skin quality. What's impressive? The elasticity. 26% increase in elasticity after only 6 applications. What does that? Nothing. 100% re-epithelialization of wounds. So it's great for wound healing. And again, it's reducing the downtime. And those clinicals have been published. We have looked at other so-called carboxys on the market, and we've actually done studies on them, and none of them are touching microcirculation. So you can be sure that the CO2 lift is the only carboxy gel, true carboxy gel. I'm just going to quickly run through some pictures for you to see before I turn this over. This is one of the things that made us know that we would be so beneficial for surgeons because of how it really accelerates healing of the skin. We did a diabetic wound healing study, and all of there were 8 months of non-healing wounds. They closed within a month, 3 applications a week. In a month, they closed. And again, this I think was the biggest challenge for us because it has so many different indications. It can be worked for, as I mentioned before, surgeons, for aesthetic providers, for the skin. Where do we focus? It's helping with complications. It's helping with eczema, rosacea. Where do we focus? So that was a big challenge for us.